Another important part of communication skill is how do you answer questions? When people ask you a question, sometimes you feel, floored that how do I answer that? And if the question may be from a patient, the question may be from a friend, the question may be from media, the question may be from anyone. How do you deal with questions? So there are a number of ways of answering questions which you are asked. And one of the common ones is what is called as ABC. A stands for acknowledgement, B stands for bridge, and C stands for your comment. So for example, somebody asks you about a question about, let's say, illness that, is COVID-19 going to come again? So the first part would be you acknowledge. So by saying that, so you want to know whether COVID-19 will come again. And then you bridge it by saying, well, the evidence shows that, with the vaccination and with the efforts which have been made, things are better. So you bridge it and then you give your comment in the end saying that, well, you are not sure what is going to happen. So acknowledge, bridge, and then you give your response. That is one way of answering questions. The other way of answering questions is asking the question back. So if a person asks you a question, same way, do you think COVID-19 would come back? And then you ask them, what do you think? So it helps you because many times when people ask you a question, they already have an answer in their mind, or they presume what the answer would be, and they are just looking for either a confirmation or a clarification. So it is very helpful to know what people are really thinking. So let them tell back that I think that it might come back, and then you can either confirm what they are saying if it is correct, or you can reject what they are saying and give them a new answer. So answering questions, it's again a skill which one must develop. The third way of answering questions is that before answering the question, you ask some more clarification from them. So get some more information, understand what is the background, what makes them ask the question, and you can ask that. So suppose somebody asks, well, is COVID-19 going to come back? Then you ask them, what makes you ask that? What made you think about this question? And they would say, well, I am seeing in the media what all is happening. And then based on that, well, then you can, once you have understood that, then you can respond to that question. So it's a good strategy to reflect back the question and answer the question with a question before you answer the question. But remember, many times people think that you are trying to avoid the question. So in which case you can clarify that, well, I am going to answer your question, but before I answer the question, I would like to ask you something, okay? And this answering back with a question works in most situations, but not every time. So if you are sitting in an examination, in a viva or in an interview, and somebody asks you a question and you ask them back, what do you think about it? It's not going to work. So you need to be a bit judicious about asking. The same way, if a person is in a emergency or in a hurry and there is no time to get the background of a question, it might be worthwhile to answer the question directly. But in such situations, and even in the other situations, when you answer a question, it might be very helpful if you check with them whether they have understood what you have answered. So you ask them, well, I said so and so thing about COVID-19. Can you tell me, what did you understand? And they will say, well, you said that COVID-19 is not going to come back. You say, oh, no, I didn't say that. So you start all over again, or you say, yes, that is what I said. So answering question is listening to the question, clarifying the question, responding to the question, and then checking whether the person has understood the question. Okay? Any questions? Thank you.